Hi, I'm Desi. I'm a dietitian from Tree of Life Nutrition. Today I want to talk about irritable bowel syndrome and our immunity. So there is no doubt about it, the science definitely suggests that with IBS we get an exhaustion of our immune system. So it's very important that we understand what the science actually is telling us about our immune system. So the literature definitely supports a systemic or intestinal immune activation when we are dealing with IBS. So when we talk about immune responses that we actually see in IBS, one, a post-infectious IBS is one of the things that we see most often. And those post-infectious IBSs are generally after we've had some sort of gastric bug or gastroenteritis. Secondly, IBS symptoms can be seen in inflammatory conditions such as IBD, inflammatory bowel disease, microscopic colitis, and celiac disease. Number three, systemic immune activation, which is generally associated with functional dyspepsia, fibromyalgia, migraines, interstitial cystitis, vulvar vestibulitis. Number four, mucosal immune activation, which is generally caused by undetected food allergies, by stress, by previous infections, by abnormal microbiota, by bile acid malabsorption, and lastly, by an increased intestinal permeability. So when we look at the literature and what we know from the science is that IBS treatment is really about fixing fiber content. So it's not just about always increasing the fiber, but it's also about the types of fiber that we should be consuming. There are definitely literature reviews now on the suggestion that those who have IBS should be screened for zinc deficiency and also a copper-zinc ratio. So zinc deficiency may perpetuate underlying pathophysiology of IBS and contribute to associated mental health issues. And the reason why that is because zinc has an important role in our immune system, and it has an excellent and important role in brain-gut axis or mental health. And lastly, zinc influences the gastrointestinal barrier integrity. So zinc is required basically to help with our immunological functioning, hence the IBS and immunity link. In summary, when it comes to the nutritional support that we need for increasing immunity with IBS, we need to look at a balanced eating program, as cliche as that might sound, making sure that you're having adequate carbohydrates in the form of whole grain breads and cereals, and also having adequate fruit and a variety of different colored vegetables, making sure there's 3 cups of vegetables per day, both raw and cooked is very important. Lots of legumes, so the rich prebiotic type foods which are necessary for fueling the gut microbiome. So adequate water as well is required, and making sure that we're meeting our fiber requirements during the day, over 30 grams of a variety of different fibers, and making sure that we reduce down our sugar intake and saturated fat intake to decrease inflammatory responses in the body. To meet those micronutrients that we require to fight off infection, we need to be consuming those rich antioxidant type foods, herbs and spices, garlic and onion, making sure that you're also having, vitamin C rich fruits, and also, as we said, the antioxidant rich polyphenols that we get from, our extra virgin olive oil and all of our vegetables, and omega-3s that we get from our fish and walnuts and flaxseed meal as well. Zinc, of course, is one of the nutrients that we really need to hone in on because it's the most likely to become deficient in IBS. And so zinc comes from a variety of different sources, including beef and lamb, and oysters and sardines, and also cashew nuts. So trying to include that into the diet to boost up your zinc levels. If you have a deficiency, then we may need to supplement that for a short period of time until the deficiency is sorted, and then the nutritional side of things can maintain that level. Please make sure you're also drinking adequate water. That's super important, especially when we're on a high fiber diet. Until next time.